Indications and usage. YUTIQ, fluocinolone acetonide intravitreal implant 0.18 milligrams is indicated for the treatment of chronic noninfectious uveitis affecting the posterior segment of the eye. Please see the indication and usage statement and important safety information at the end of this video.
Before seeing Dr. Dayani and Retina Vitreous Associates, I had not seen an eye doctor since I was a kid. I'd only begun using 1.0 reading glasses for the first time when I was about 45 years old. My problem started with a sudden need for stronger reading glasses, floaters, lots of floaters, and I was seeing spinning lights in my vision upon exertion. I'm an avid hiker and would notice that after hiking up a steep ascent, I would get whirling lights in my vision. At first I thought it was kind of odd and just brushed it off, but then the lights became worse and more frequent. Then it became harder to read the instruments on my dashboard of my car or see the stereo readout clearly. At night it got harder to see as well. It became a little challenging hiking with sunglasses on because it was hard to read the terrain. I had to be careful going up a flight of stairs if they were not well lit. After some time had passed and the lights got worse and more frequent, I mentioned it to my partner. He suggested I see his optometrist as I did not have one myself. That began my whole journey into birdshot chorioretinopathy. The optometrist I first went to referred me to Retina Vitreous Associates. The first doctor at the practice did all the testing and diagnosed my condition. They discovered I have a gene for birdshot chorioretinopathy. Then Dr. Dayani took over my care because he is a retina specialist. Before everything happened, I only saw my primary care physician, but I did not see him for my eye condition. My experience with Dr. Dayani has been exceptional. From the very beginning, he has been very thorough with his explanations and educating me on my condition. Growing up, I had a family doctor and a really great experience with him until he retired. But up until I became a patient of Dr. Dayani, I had not had that same connection with doctors. Now, I have that connection with Dr. Dayani. He is very personable, and his bedside manner is something I really like. Until I was connected to Dr. Dayani, I only saw doctors when I was sick, and the visits usually went pretty quick, and they just wrote prescriptions. Appointments, lots of appointments. I was on heavy doses of oral steroids and immunomodulators that really took a toll on my body. I had weight gain, warts on my face and inside my mouth, and I did not like the mental side effects of steroids. I eventually got into 3 clinical trials, which meant different self-administered injections and lots of visits and testing. I also had to see a rheumatologist during this time as well to monitor the effects of my body from the different treatments I was on. The most impact from all these treatments was time and travel. I live about 30 miles from the offices where the clinical trials were done. I always got a very early morning appointment to make the commute a little easier. The appointments lasted about half a day, and I took the rest of the day off to recover. One aspect of all these studies and appointments was that I had to get my eyes dilated each time. I hate getting my eyes dilated. It makes for a tough drive home also. I worked from home at that time, and with my eyes affected most of the day, computer work was out of the question, so that was the hardest part. My whole day seemed shot. What was good about being in the clinical trial studies was the level of care I received from Dr. Dayani and his team. I actually liked going to my many appointments because of the care I received. After each of the clinical trials ended, I had a choice to go back on oral steroids or take a steroid injection in my eyes. My first reaction was to reluctantly go back on oral steroids. Who wants needles stuck in their eyes? Dr. Dayani said he understood as that was the reaction of most patients, and he reassured me that it was not as bad as it sounds. I agreed to the injections. The injections really were not as bad as they sounded. Not long after, Dr. Dayani told me about a steroid implant and said they could last for up to 3 months. I agreed to the implant and had pretty good results. I'm not sure how many were implanted over time, but I developed steroid-induced glaucoma and cataracts. So I had to stop the implants and eventually had to get the cataracts removed. After that, I was told that I might have to go back on oral steroids, which made me shudder. But I ended up not going that route because Dr. Downey told me about there was another type of steroid implant that was approved by FDA, YUTIQ. I was told YUTIQ may last up to 3 years, and I jumped at this opportunity. The process to me was just like other steroid implants. I was ready for it. It's not the most comfortable process to go through, as you get a couple needles in your eye, and you must get your mindset for those 2 needles. They do one at a time, thankfully. My eyes did get a little irritated. It felt like there was sand in my eye for about a day after the injections, but it goes away after about 24 hours. When I tell my friends what I've been through with all the injections in my eyes, they cringe and ask me how I can do that. But it is not as bad as a process to go through as it sounds. I like the fact that I get fewer injections. I see Dr. Dayani every 3 months for follow-ups. He takes pictures to see how the inflammation is doing and does an eye examination. But to not have to go through a clinical trial or a systemic therapy that required me to inject myself under the skin each week has been freeing. To me, my vision is very good. Dr. Dayani tells me that the inflammation is way down. My vision is not perfect, never will be, and I understand that. But my vision has vastly improved, not deteriorated, since the YUTIQ implants. I only need readers for very small print, and I can see my dashboard clearly. I can read most things that are up close without readers. YUTIQ has improved my vision. My main reminder that I have an eye condition is that I have to go in for a checkup every 3 months.
Indications and usage. YUTIQ, fluocinolone acetonide intravitreal implant 0.18 milligrams is indicated for the treatment of chronic noninfectious uveitis affecting the posterior segment of the eye. Important safety information. Contraindications. Ocular or periocular infections. YUTIQ is contraindicated in patients with active or suspected ocular or periocular infections, including most viral disease of the cornea and conjunctiva, including active epithelial herpes simplex keratitis, dendritic keratitis, vaccinia, varicella, mycobacterial infections, and fungal diseases. Hypersensitivity. YUTIQ is contraindicated in patients with known hypersensitivity to any components of this product. Warnings and precautions. Intravitreal injection-related effects. Intravitreal injections, including those with YUTIQ, have been associated with endophthalmitis, eye inflammation, increased or decreased intraocular pressure, and choroidal or retinal detachments. Hypotony has been observed within 24 hours of injection and has resolved within 2 weeks. Patients should be monitored following the intravitreal injection. Steroid-related effects. Use of corticosteroids, including YUTIQ, may produce posterior subcapsular cataracts, increased intraocular pressure, and glaucoma. Use of corticosteroids may enhance the establishment of secondary ocular infections due to bacteria, fungi, or viruses. Corticosteroids are not recommended to be used in patients with a history of ocular herpes simplex because of the potential for reactivation of the viral infection. Risk of implant migration. Patients in whom the posterior capsule of the lens is absent or has a tear are at risk of implant migration into the anterior chamber. Adverse reactions. In controlled studies, the most common adverse reactions reported were cataract development and increases in intraocular pressure. Please see full prescribing information.